discussion on the crying need for predictive analytics to address the mental health crisis in India. An estimated 10% of India's 1.4 billion population has suffered from mental health problems in some form. While the still continuing COVID-19 pandemic has clearly demonstrated the merit of quick detection and control over curing a clearly inadequate curative ecosystem, there are only 5,000 psychiatrists in India, or 0.3 for every 100,000 persons, and less than 2,000 clinical psychologists in the country. In contrast, developed countries have 6.6 psychiatrists per 100,000 persons. The panelists intend to discuss their observations regarding the diverse factors that are leading to unhealthy minds, such as heightened expectations, sense of inadequacy when these expectations are not met, loneliness, domestic discord, etc. The panel will also discuss how ethnographic studies and predictive modeling could combine to play a vital role from mapping of different manifestations of mental unhealthiness, creating linkages between human behaviors and their motivations, quantifying the incidence to developing a model for prediction, and creating a simple early warning systems across the nation and quarterly updates and review. We want to extend a warm welcome to our panelists for this session. Mr. Siddhartha Ghosh, consulting strategist, who will also be moderating the session. Mr. Praveen Dwivedi, director, Hitachi MGRM. Ms. Shipra Dawar, founder, IWill and eSight Clinic. And Ms. Suprabha Karanth, ex-Aon PLC and Medlife International Private Limited. I will now request Mr. Siddhartha Ghosh to moderate the session. Thank you.
A very, very warm welcome. Yes, our session is on the crying need for predictive analytics to combat mental illness in India. But before that, who are we and why are we here? The who are we part is interesting. We are classmates from ISB's inaugural virtual interactive learning course on understanding public policy. A team of what? 60 odd, out of which some of us, 20, have got together and are creating a forum named Bharat Bhagya Vidhata. And what does Bharat Bhagya Vidhata intend to do? We intend to identify, discuss, and highlight matters of importance in today's changing India. And today I have with you here an eclectic matter that pretty much covers up all flanks in terms of what we are about to discuss. So if I go from extreme right, Shipra Dawar, who is founder and CEO of IWill and eSight Clinic, which are India's leading mental and digital health startups, incidentally supported very heavily by the likes of Microsoft, UNICEF, ACT, and the Bill and Melinda Gates Foundation. Incidentally, Shipra is much decorated. She has been listed among the 100 most influential healthcare leaders globally by the World Health and Wellness Congress. Suprabha is a chartered accountant by profession, 20 years standing, and across, I think, the entire firmament of insurance. And if I may use a pun, she has spent eons in the sector. Her last post being as she was part of the National Executive Council with Aon, where she also headed the finance and growth vertical. Praveen has worked very strongly among people, looking at the impact of technology in their lives, strongly associated with both the private as well as the public sector. And he is currently the principal public policy affairs with Wheebox. And his professional journey has included stints with organizations such as Hughes, Intel, Ericsson, and Hitachi. I am Siddhartha. I have worked among people for about 27 years in various capacities across Asia, starting off as a journalist, becoming a civil services probationer, leaving that, very few people again do that, moving to being a multimedia insightist. And what I did is recently, last year, I branched off on my own and I have created a startup named Contours and Pathways that provides strategic advisory services to clients across India and Southeast Asia. So here we are. But then the first thing that we would like to understand is why is it imperative to discuss mental health today? And I want to tell you a story. Last year, towards the beginning of last year, I was part of a nationwide study dealing with the National Urban Health Mission that took me to various parts of India. I covered 8 cities. We talked to people ranging from district magistrates to Asha and Anganwadi workers. And we also conducted a large number of activation sessions with them. Now, one of the things that struck me is that yes, there's much which is there in the written word. If you look at the National Family Health Survey 5, NFHS 5, there are numbers about how many people are suffering from substance abuse, so on and so forth. But at the same time, while this was there, when we were talking to people, when we were going to the remotest of blocks and talking to them, we realized that there's so little understanding of mental health. And that is one of the things that struck us very badly. It's not a question of a statistic of substance abuse. There are so many colors, so many hues of mental health that people don't even recognize, let alone rectify. पहले recognition की ज़रूरत होती है, उसके बाद आप solution के बारे में सोचते हैं. That was hardly there. Now, one of the things that we were doing while we were doing the classes at IWill is we were getting together every Saturday, every Sunday, is it? Every Saturday. And we were presenting to each other, we were presenting from our experiences. Okay, so my experience with public health, somebody's experience with something else, and we got together. And we got talking. And that's how Bharat Bhagya Vidhata came up. And just as Bharat Bhagya Vidhata was coming up, we had this wonderful, the announcement for this conference. I said, hey, we're talking about it here. Why don't we talk about it in front of a wider audience? And bring in some kind of awareness, enhanced awareness about the problem that exists in India. And therefore, here we are today. The other part that we did understand is that the pandemic really brought our healthcare system on its knees. And it's a very clear indicator that when it comes to a country as huge as ours, 1.4 billion and counting, this year, I believe, we're going to be outstripping China as the most populous country in the world. Not a distinction I want to really wear on my sleeve. But you do get the point. Now, therefore, if you are to depend on our existing infrastructure to cure people, it is not going to happen. Look at what happened during COVID, right? Look at what's happening in China, a much bigger country, supposedly with much better infrastructure than ours. Even they are struggling with curative health. And therefore, what is very clear is that preventive health needs to go hand in hand with curative health. We cannot do without preventive health. And this is what has brought us to discuss it today, that we can prevent only if we can identify, we can put numbers, and we can understand the gravity of the situation. And that and this is exactly what we will be discussing. And this is the flow. We will have opening remarks from our panelists. We will we'll have an understanding of what has been happening in India until now. To what extent is it adequate or inadequate? Before coming to our recommended solution, and therefore what would be the implications on public policy? All right, this is a lecture. Actually, it is looking like a lecture, but what the hell, as long as we're making a point of 5 minutes. Yeah. And therefore, and of course, the few of you who are here, we would really welcome a lot of questions. All right? So let's get cracking. Opening remarks. Look at numbers. People love starting with numbers. It has been estimated that approximately 10% of India's 1.4 million population has suffered from mental illness in some form or the other. It need not be clinical, it could be anxiety, it could be anything, in some form or the other. Also, according to the World Health Organization, nearly 15% of the global load of mental, neurological, and substance abuse, 15% of that load comes from India. Look at the link. 15% of the world's population is also coming from India. So it's not surprising that 15% of the caseload also comes from India. Right? And about a third of the patients seeking help from healthcare facilities could have symptoms of hypertension or depression. जाते हैं किसी और चीज के लिए, लेकिन साथ में है बहुत कुछ. They actually take a whole baggage of litanies with them that they might know about, that they might not know about. And that's where the doctor also becomes a counselor. And also, there also needs to be the acknowledgement that this can be very common as the common flu, as common as a stomach disorder. And also, that solutioneering can start very, very small. If somebody is sitting with a long face at home, typically हम क्या करते हैं? बोल देते हैं, you're just having a bad day. Get over it. कल ठीक हो जाएगा सब कुछ. कल ठीक नहीं होता है. 3 दिन में ठीक नहीं होता है. 7 दिन में ठीक नहीं होता है. And then, while the world is looking the other way, it becomes something more serious. हमारे नाक के सामने it happens, and we don't even realize what is happening. And therefore, it's also important to understand that solutioneering can start very small. Okay? Try and understand the situation. Empathize. Empathy, the E word. That people talk about, very few understand. And therefore, we don't need to over-dramatize things. Yeah. Iski, whoever, let's be gender neutral, dimag kar gaya. Or some sort of power, we end up labeling so many things. And therefore, things can start really, really very small. Some movie like Medlife, it was but you get the point, right? And therefore, my opening remarks, in order, we could start with Suprabha, followed by Shipra, and then Praveen. Suprabha, the stage is yours.
Thank you. Thank you. Firstly, I think it's such a great moment that we are sitting here in a policy dialogue conference talking about mental health. I think that's a great start. Leaving everything aside. For me, 7 years back, when I was going through a low phase in life, I was not really I didn't know what I'm going through. I was like, okay, it's something that's going on in my life. Until Deepika Padukone actually educated me that it is depression. I don't know her, she's not a friend of mine. She was talking to a news channel where she came out and spoke about her journey with depression. And I was like, yeah, this is exactly how I'm feeling. Very scary, isn't it? Sadly, that's how I diagnosed myself. That's not how it should be, but that's how it was for me. But now, with COVID, things have completely changed. The large-scale impact that COVID brought in terms of the way we work, the way we interact, just the isolation, right? The social isolation, the loneliness that, be it the senior citizen or the young adults who had to face it, be it the uncertainty about the job, all of that, if you see, are ingredients of depression and anxiety, isn't it? And so here we are, where we have hence so much large scale of reported cases of mental health and of depression and anxiety specifically after COVID. In fact, WHO has stated that about 20% rise in the reported cases in many countries, and in certain countries up to 40%. So that's the scale we are talking about. So the time is right. We have all the years of the policy makers at this point, and I think we should just play with the momentum that has come with it. So yeah, that's my opinion.
And very unfortunately so, the circumstances under which the momentum has.
So mental health is something that is very close to me. I run a digital mental health startup, and how it started for me was anyone can have mental health issue, I can have it, and I did have it, right? So that's the point where you start with when you're talking and acknowledging the problem for mental health. there's a lot of othering that happens. You know, it can happen to my family, it can happen to my friends, it can happen to my colleague. It cannot happen to me, right? Somewhere we need to destigmatize mental health by addressing the elephant in the room, which is it does happen to us, which means us as individuals. That's where we start. And why does it happen? Well, it's very simple. And I could give an analogy. If you are playing football, there was World Cup, recently, and you just fall while you are playing. You have these scars because of the play, and you wear them like they're your badge of honor. Similarly, when you are in your life going through the ups and downs and challenges, sometimes someone in your family may not be well. Sometimes you may be having issues that you may not be even able to describe or put into words. Like something is wrong, but you can't point a finger to. That's because life is happening to you. That's because emotional scars come as a process of living the life. And so having mental health issues is just so normal, right? Just like life happens to us, mental health issues can happen to us. If we start with that, I think one of the ways in which I like to introduce mental health is never say he or she can have mental health issues. Start with I can have mental health issues. Because that othering isn't doing good to anyone. If we need to acknowledge mental health, we need to do it for us. And that's how, the start of the solution begins from that.
Thank you, Shipra. So I think Shipra, Suprabha, Siddhartha has really set up the context. And I would like to thank the ISB for accepting this topic, agreeing to make sure that this is being heard, it's being talked out. And as Shipra rightly mentioned, we need to start talking about it. We can't detach ourselves out of it. We can't say, usko hoga, mujhe nahi hoga. It has to start with I. The best part is, I feel if you want to have any solution to the problem, we need to understand that there is a problem. And that's where it starts, when we are talking about the mental health crisis in the country. Having said, while we talk, we will touch upon all the areas we'll talk on how mental health is coming up in our country or worldwide. We'll talk about how do we want to combat it. We'll definitely touch upon the size of and the tenure of pandemic which we've already witnessed, and how the entire social convergence happened. I would say everyone came up for each other, cared for each other in terms of being either a good neighbor, being a healthcare worker, or an enterprise, or the government. Now, we have been talking about when it comes to government, we keep on saying, government doesn't work, they don't perform, they don't perform in time, they're not so aggressive. But look at the kind of, the pace they really showed up while the pandemic was going on. And they brought in a lot of technology, they brought in a lot of schemes to happen, And when I say technology, we were the only country who were doing online certification for the vaccination. We were the only country who was having a separate Arogya Setu app and a COVID platform. Be it vaccination, be it certification. So we need to think about all of this, and this is the area. If we are available for each of us, we can combat any illness, be it mental or anything else within the society. So I end up of setting up the context here is that if you have a will, there is a way. So let's start talking, Sid, and over to you.
Wonderful. So, yes, there is a will, there is a way. What has been happening till now? What has been happening at the government level? What has been happening at the policy level? What has been happening at the ground level? Now, one side of the story is always very quantitative. People will always talk about the mismatch, the demand-supply mismatch that we have within our process, within our country, and generally say, ye to ho nahi sakta. Somebody will call it glorified crystal gazing, as George Heller had once called Indian planning, what's called a glorified crystal gazing, right? And then we have Niti Aayog, which is actually seriously, I have been working with them. They're seriously doing a lot of stuff. बहुत कुछ करना है, लेकिन शुरुआत तो हुई है. Well, it's not a political discourse. But nevertheless, there is the quantitative side of it. At the same time, there are those little initiatives that are taking place. I come from Calcutta, live in South Calcutta. There is this crossing in South Calcutta called the Gadiyahat Mall. Okay, it is one of the busiest crossings you would find anywhere, and it is mayhem. What has happened is there is an island at the Gadiyahat crossing. What the Calcutta police have done, the Calcutta police, mind you, they formed a chess club there, right there, and with multiple chess boards. So what happens? You're standing there for a bus. You had a bad day at the office. You don't want to go and kind of bursaw it on your family. You go and play a game of chess. Even if you don't know how to play or it's full, you at least watch it. You watch a game or two. एक घंटा वहीं पे निकाल दो. By then you would have cooled off and so on and so forth. फिर घर जाओ. It makes such a big difference. It's a small little thing that makes such a big difference. I remember when I was in Thailand. I used to live in Thailand for 6 years. The police again there, got together and they created. Thailand has those huge overbridges, right? Uske niche they created futsal fields. Everybody knows the extent of substance abuse there and all that. People got to play there. So on and so forth. So much of it is happening. But now, let's kind of look at slightly the bigger picture. What has been happening at the national level. So let Shipra begin.
So I think when it comes to policy, India has been at the very helm of it. We wouldn't want to accept it, but that's a fact. When it comes to the mental health policy and act of 2017, we just did not decriminalize suicide, of course, which was such a pain. I mean, just to have suicide as a criminal offense was so outdated. We did that, but the 2017 bill has been a landmark when it comes to what mental health industry should look like. So when we talk about all the policies that exist in the world today, whether it's US, whether it's UK, whether it's China, India actually has one of the best policies in the world to tackle with the problem of mental health. And I'll tell you why. The digital health initiative that the world is talking about today, 2022 and its extension to it, the government got the telemental health program. The 5,000 odd psychologists and psychiatrists that we talk about, the government recognized it and said that we have so many other counselors who've been trained in clinical and counseling psychology with MSc degrees, which are proper degrees. How do we get them into the clinical counseling foray? And they created the Allied Health Professional Act, which kind of takes the number from 5,000 up to 50,000 plus and adding on every year or so. Then another aspect of the Indian mental health policy is that there is a huge role of ASHA worker in providing the first screening or first support at the PHC-CHC level, and that has already been brought in the ambit of policy. So when we talk about what all needs to be in a robust mental health policy, a robust mental health policy needs decentralization. A robust mental health policy needs, digital inclusion. A robust mental health policy needs professionals. A robust mental health policy needs primary care to act as the center for mental health care as well. All of that tick boxes the government has already made. So when we talk of paper, the policy really works well. What is the problem with it? Maybe it's because we still don't have a supportive infrastructure to actually bring the policy to life. And that's happening slow and steady. But in terms of the paper, we have a very, very solid policy to start with. And this is something we should all be very proud of as Indians.
I'll speak from the corporate sector point of view. When COVID happened, suddenly I saw a shift, right? I mean, I saw things unfolding. We, as a corporate, moved from never talking about it. It was almost like don't ask, don't tell. And we moved to a do ask, don't tell, and let's talk. So there was a big shift, and there were a lot of initiatives because we were very clear that we have to take action. So some of the initiatives, like the first thing is what? Create an infrastructure for people to feel safe, right? It's so important for them to feel safe in a corporate sector all the more, right? Where they should feel okay to come and talk about how they feel, you know? So that was the first thing that was done. Then of course, tying up with various experts in the field, be it the counseling services 24/7 for our colleagues and also their loved and dear ones. We then did also things like, obviously the fitness apps, tie up with for the meditation apps, encouraged fitness, all of those areas also came in. Training managers was very important. We realized that we need to start with destigmatization on an immediate basis, right? So training managers was at the forefront. A lot of volunteers came forward and took up mental health first aider certification so that they can really help the colleagues. Leave policies in terms of wellness leaves came up as a concept in the corporate sector, I would say. So those were all big wins. Tech also came in handy, at least in the company that I work with. We actually onboarded HR chatbots, wherein the bot would chat with the colleagues on a predetermined frequency and start with how are you feeling, and then the conversation will go from there. And the data point from that really helped, in addition to the types that we had, right? So we got insights about what are the search results of our colleagues, what are they worried about. So those, in fact, one of the top searches was on anxiety, followed by stress and work-life balance. And sleep, that was one of the biggest read articles at that point, and that helped us in terms of actually coming up with focus group discussions and calling experts and talking about those aspects. So I would say a lot was covered on that aspects at that point.
I did find something very interesting, Suprabha. You did mention training the first responders, and the thought that came to my mind was it's like the paramedics of mental health.
Yeah.
Very interesting. There is something
Because we felt that if there is a need and they don't want to go to because there's still stigma, right? Talking to the counselors, it was at the initial stages. So having your HR leader or your other colleagues as the first phase, they felt like a comfort to talk about it. So that was something that I felt was a great step that was taken.
Incidentally, if I were to sum up what the team has been saying, and I just want to share with you certain observations that I had as late as 3 weeks ago when I was consulting with a foreign bank in Malaysia. Now, what was happening there is that they were trying to create some products for employees that would keep employees linked to their particular companies, because everybody, the moment the economy opened up, everybody was on a flight mode. Okay, better naukri milai kahin pe, some tech companies pay me more than my current job, and so on and so forth. And one of the things that we did see is that the HR managers were freaking scared for the simple reason they didn't know what hit them. There was such an exodus. They were not trained enough to handle this kind of issue, and more importantly, they did not know what to tell their bosses, the owners of the company or the CEOs, because the bosses would not understand. And that's where, the overall understanding, and when I talk about India, and when the panel has talked about India being significantly further down than some of our other countries, something that we don't even acknowledge, I think this is a point to be taken and a point to be proud of. A starting point though, but we're still better off than a lot of other countries. Now, the point here is, we'll always say कि है मतलब काफी नहीं है. if I'm glamorous enough, I'm going to pose a question: is the glass half full or half empty? Right? And is this adequate? Is this not adequate? Let's at least say, why is this not adequate? Now, look at the screen and think about it as a continuum. Right? On the one hand, on the extreme left is dismissing something as just a part of the ups and downs of life. Okay, आज मन ठीक नहीं लग रहा है, ठीक है, बैठ जा, चाय पी ले, शाम तक ठीक हो जाएगा, और ठीक हो जाएगा. Right? And the other extreme is social labeling possible ostracism. I was telling you about the study that I was doing last year. And we were in Meghalaya, we were in Shillong. Shillong has a huge history of substance abuse. And the problem here is that people are not even willing to talk about it or acknowledge it. Mainly because, what if my neighbor gets to know, then my son or daughter or I am ostracized? It's going to be the talk of the mohalla. And especially in smaller towns, where the mohalla can literally be next door, and everything's around, and your ecosystem is around your mohalla. There could be social labeling. You could call it pagal, you could call it anything. Bolne mein kya hai? At the end of the day, whether it is politically correct or not, people will call you names. So that is the other extreme. Now let's kind of look at, what is it? If we are to look at, do we have enough understanding of mental health in the country? And just to take us through the bigger picture, once again, we will start with Suprabha.
So you're right, Sid. I also feel that, two aspects about mental health, which is the greatest deterrent. One is proof of illness and invisible nature of illness, right? So let's look at a physical illness that we have. Say, temperature, right? And I get fever. What happens? I just need to show the thermometer, that's it, end of conversation, right? I get the care that I need. If the temperature is high, I'll be taken to the hospital. There'll be further diagnosis. They'll say, okay, is it malaria, dengue? There's so many modalities, right? And then the treatment starts. But with mental health, nothing of that sort happens, right? In fact, it's just a vocabulary. I always feel that. And I say that with all my heart because I have spent so much time explaining about how I feel. So that's all that you're dependent on when it comes to mental health. And then when we talk about the invisible nature of it, say you are met with an accident or you've broken your leg, you just have to show up in a way, right? I'm not trying to say this is versus that, but just giving an idea that I just have to show up and again the care comes in, right? Am I going to hear things like, hey, come on, everything is okay, it's all in your head, come on, you'll be okay, let's hit the gym, come to the ground. Nobody's going to say that, isn't it? But what do you hear the moment you say, like everybody you did, right? You get all those, everybody becomes a doctor. So yeah, I mean, these two are the biggest from my perspective. Additionally, if you look at it, so many things I spoke about from a corporate point of view, right? This distinction is how I feel, it's not, there is so much of things that has been done. It's not about how full, it's about mental wellness versus mental illness. Now all the initiatives, if you see, is towards mental wellness, more of sustaining, maintenance, prevention, and mental illness is more structural, right? I mean, it's a structural barrier you have to look at, pretty much what I spoke about, address these two things. So from that perspective, I think there's obviously a long way to go.
So I highlight kind of two things. One is about the industry.
That's okay. Are we open to discussion?
Oh yeah, please.
So I would like to make a point on what you just said, that social labeling happens in small towns or maybe cities. But I would like to rectify it in a way that social labeling happens everywhere, in every metro city, in every organization, in every place you could imagine. Because, I don't know, stigma or whatever you may call, whatever you may name, and even with your parents, they'll be okay seeing you taking a vitamin D or a multivitamin, but they would be really harassed to see you having an antidepressant, right? So it is just not about it happening in certain areas of the country, it happens almost everywhere.
Absolutely, completely. And in fact, actually, the reason why I mentioned the smaller town is because, given the proximity, everything is closer.
Right.
In a larger city, you can melt in somewhere.
You can blend it.
Yeah, but then it also has a positive spin to it, because when we were doing, the way the governance structures were responding to COVID, for example. Again, a Shillong example. A small community, people needed to have plenty of things done. The entire bureaucracy was stepping up. Lines were getting blurred, people were getting together. And one person who was heading their version of the Jal Board, the waters, said, look, if I need to do this, the person who's coming to me with a representation would be my neighbor, because we're such a small community. Okay? And therefore, it puts additional, it's not pressure, but it puts additional responsibility on me to get things done. If I am sitting in the Calcutta Municipal Corporation, where that building itself is a maze, I can literally hide away. But I can't do it in a smaller town, where everybody knows me. I might walk out of that place, I'm an officer by day, I'm a human being by evening, right? And then I have nowhere to go. And that's where, the smaller the organization is, I think the pressures are a lot more to respond, and the responsibilities. Because not only are you the chief tehsildar, you're also possibly the mubola chacha of the person who's sitting there and who's afflicted. So the responsibilities end up being escalated, being magnified. So from that perspective, yes. But yeah, I take your point completely. I come from a joint family, and I can tell you that mental health starts with the family.
Also have a point to make to a follow, like what Suprabha mentioned. Just like probably the organization took the first step to address mental well-being at workplace with HR leaders or whatever, the direct HRs or counselors, like counselors at work and managers at work, being those identifiers or like the first responders, how you named it. But I feel somebody who's responsible for your deliverables and then judges you at the end of a quarter or a year cannot take your mental health, because in the end it boils down to simple, then we are not at all destigmatizing it. We have a achievement attached to it, and a first responder has to be detached from your performance at work, because then it's not seen exclusively. And this is one thing I think you as leaders probably at your own organization might also form policies at work, but a person probably gauging at my achievement at work shouldn't be my first responder. That's one thing.
That's actually one of the things that I wanted to say, why this is inadequate. So one of the things, and I think coming from somebody who's founded a mental health startup, and this is what I do for my life currently, I believe that when somebody has diabetes, we don't try and dissect their reasons of why they got into diabetes. There's a clinical model to help that person through it. Unfortunately, when it comes to mental health, everybody wants to dissect the reasons of why someone has a mental health issue, and then becoming like you are somehow, you may know better about their illness than they do. I think that's what needs to stop. We need to acknowledge someone has a problem. We need to create a space for them to maybe do a self-test. And there are plenty and enough out there which are clinically validated. And then for them to meet somebody who is actually a clinical professional, who can actually help them through that, but also keeping low on the opinion market, right? My reason for having a mental health issue may be so different than someone else's, and who am I to judge with that spectrum, someone else who has that, right? My reason could be as trivial as to say, for instance, there was this debate that how trivial could be the reason why someone gets triggered for a mental health crisis. And I'm like, there is no way you can predict that, because you can't predict that for physical illnesses as well. There are so many factors. Childhood plays a reason. How you were, plays a reason. What are the triggers around you play a reason. And then at other points, you just can't tell why something is happening. So the first point is, I'm not saying over-clinicalize the entire industry, but I do feel that unlike physical health, where you have a physical health model. We don't have a mental health model that's available to everyone. We have an opinion market, and that's what we kind of need to balance it out. Yes, it's important to have a space where we can talk about our issues, but with that also runs the risk of us trivializing someone for their issue, which may be so valid to them. So those are the points that I have.
I think the point about trivialization also, कभी-कभी क्या होता है कि यार हो जाएगा. We tend to be very yari, over friendly about it. But at times, for the person who's on the other side of it, it's not necessarily very funny. And the reason, my point of view is because I've worked with people. I used to be a qualitative researcher when I started off, because I've worked so much with people. Across offices, what had happened is all the HR teams used to come to me. Okay, chalo ye karna hai, wo karna hai, and I was very heavily involved in development and HR, so on and so forth. I have a very, in my industry where I come from, insights, HR is glorified admin. Okay, at the end of the year, ek event karte hain and they try to be funny with everybody. It is not, frankly speaking. So I used to get involved a lot, and the borderline between being friendly and empathetic and trivializing it is very, very thin. And that is where, when everybody tries to be a mental health counselor, we run the risk. And perhaps, and that also brings me to another point, perhaps the sensitivity of mental health and mental illness needs to be driven from a very early age at the school level, so that as people mature, their responses also mature. It's not trivial. I'll give you one little example, and it's damn funny. My son, who's 19, had a broken relationship when he was 16. All right. He's now considered the counselor among his peers. Whoever's had a broken relationship comes to him. But that's the point, it's a question of empathy, and it's also a question of that dividing line between empathy and trivialism.
I had one point to that. So what you just mentioned, in the US there's a program that's been running by the government. It's called Pure Health, mental health programs. What happens here is that if I've been into a situation, I've overcome it because of the help that I had, the counseling that I did, I can play a little role in someone else's healing. What I really like about that program though is that it brings in a certain structure. So it takes into account whether a person who's acting as a peer is currently free of triggers or is still dealing with it. Do they have adequate resources to help the person? So I really believe in the concept of pure mental health and how it can help, because if I've gone through a similar issue, I can very well relate to someone. But I also like this structure, this boundary that comes with it. That you're not triggering each other in the process of it. So there's a great way actually to bring more pure mental health solutions as well. But again, within that framework, which is important. Over to
Is there any mantra to overcome mental health?
So we will
like having a gym mantra.
The first thing I would say is talk about it.
What is it?
Talk about it. The first step is important.
Like hitting the gym or going to the ground.
Talk to people. Your friends, your peers, your family.
I think if it comes to me, I think
then if we talk, what is the solution? There's no solution by talking, isn't there?
No, if you just look what happens, that's what I was talking about.
It has to come from within, isn't it?
If you're not talking to a professional,
there's no solution, isn't it?
No, that's not true. So if you are talking to a professional who is trained in therapy, which is completely a science to help you. Okay, I'll give you an example. Say for instance, and this is a random example of how CBT works. So say for instance, somebody fails an exam and takes a lot of burden of that failure on themselves, right? The thinking is, I'm a loser. Now this is a thought pattern, right? A certain situation that's triggered your thoughts around it.
Yes.
Now, and that is interfering with your behavior, which is like how you are being able to live in that moment. What a therapist does and helps you with, or a tool may help you, and this is oversimplifying it, but just to kind of get to the crux of it, is that the failure might have happened. It can happen to XYZ people as well. you are not a failure. This failure isn't you. And that altercation to your thought really brings in a different perspective. So very simply, somebody who's a therapist is trained in this and much more. They're trained in helping you observe the situation you are in and be objective about it, get to the solutions that work for you. So it's not like talking to someone who is, just your friend. It's a professional. It's an entire science around there. So can mental health issues be treated? Absolutely yes. Can mental health issues be prevented? Absolutely yes. Does medicine play a role? Absolutely it does. And there are stages to it. The first thing that probably Sid was mentioning is that we start acknowledging that there is a problem. The solutions have been there. They've always been there, and now they're getting more and more structured. We just need to be open about, I need this help, and I'm going to take it. It's as simple as that.
It can take different forms. When I came back to India, one of the first clients that I had was a social media platform that was completely in Hindi, and we did an entire study across India. What we realized that post-pandemic, how a lot of that traction happened is post-pandemic, when everybody is there in the same house. Okay, किसी को कोई privacy नहीं है, etc. Mummy breathing down your neck, daddy saying शादी कर दूंगा, kind of nonsense. Yeah. These kids, they went into that particular platform and they started uploading videos. And why did they do it? Because it gave them the feeling of somebody is there to hear me, who's not there to judge. Right? अगर आप Facebook में जाओगे, anybody from your next door who pretends to be your grandmother and everyone's going to be there. For this particular platform gave them anonymity. People talked, they flirted with people who they didn't even know. And at the end of the day, it gave them a huge amount of release. I actually linked it with masquerade dancing. Nobody remembers you, at the end of it, nobody judges you, and so on and so forth. So there could be multiple channels. It's just that, what do you make of it? And that's what, it's a question of opening one's mind, but it's easier said than done. Because most of the time, the ecosystem around us asks us to conform. And that is a tough thing.
So true. I think we discussed, by and large, most of the aspects we should be talking about. What happens, if somebody is not dealing rightly with it. I've done a lot of good examples quoted by Sid as well. I had a lot of other things to talk about, but in the interest of time, I just cut it short. After hearing all of you, look, one, definitely it is very, very pertinent and important that we talk it out. If we don't talk it out, we may not give any importance to it. Let's understand it very, very clearly and be candid on that part. What is happening is, I saw a very different thing coming up post-pandemic. We have different kind of mental disorders, right? Somebody will have stress, somebody will have, anxiety, somebody will have not eating habits, disorders, and so on and so forth. Something which I saw, especially in the B-class cities, C-class cities, there's something which has come up, death anxiety. People have started thinking about that, okay, boss, so what happens, before that, what used to happen? We knew there was 60 saal, 65 saal, 70 saal, we will live, But during the pandemic, it has already created a scenario where your mental health has gone for a toss. Anybody can die at any point in time. News में पहले आएगा, बीमारी बाद में आएगी. So that has broken all the barriers of mental illness. Try to understand where we are. So my request, definitely with the policy making, we are going to do it on our own, definitely, as Bharat thanks to the Ghosh. But my suggestion and my advocacy is, when we are talking about and when we are creating schemes for people who are getting affected, the first and foremost thing is for the policy makers is they need to have some mechanism of understanding, implementing, tracking, and learning from the successes and failures. What is happening is, in the overall story, look at the SME market, right? 29% of GDP's contribution comes from there. I'll just quickly tell you a story. I wear a hat as a chairman for MSME Forum. The day it was announced, I got a call from a few people around, and one call came from a place called Agra. This guy says, boss, I am the breadwinner. I am not only running my own family, there are 1,000 other families who are associated with me in terms of my co-workers, workers, supply management, my business partners, right? Now look at his mental health. He says, look, during this pandemic, my loans I could not pay. My CIBIL has gone for a toss. What do I do with the government scheme? I'm not getting that money. And he's right. So what we need to do is the advocacy, as what we say, is this inadequate? Yes, there is some amount of inadequacy from us, within us. We need to be, really, really sensitive about it, and not only talking about it. We need to start taking some actions. So it has to be seen as actions, not only actions. Once the actions are taken, where are the learnings? So that's it from my end.
Great. I think we're running short of time, so I'll kind of come to the operative part of our discussion, and which is about creating a model for predicting mental health. And here, we're talking about a model that is scientific, that's easily actionable, given the scale of India, where we can read the early signs, engage, explore ways of addressing it, and very importantly, or even escalate it as and when required. So, I think, and let's come to it. I think it is a 6-step model that we are talking about. Step 1 would be, to map the different manifestations of mental health. It is not an amorphous whole. There are multiple different ways in which mental health is manifested, and therefore let us first start acknowledging it. This will be a long process. This will be a painstaking process given the diversity of India's population. The way people think, the way people express is going to be very different. The second one is, understand what we call the environmental factors around it. What is leading to what? What kind of segments of people do we have in the mental health framework? I think that segmentation, that initial understanding and design of the segments would be very, very important even before we get into the quantification. This would be best done qualitatively. What would work is one-on-one depth interviews, interviews with caregivers, parents, the ecosystem, then creating what you would call the framework. Quantification, obviously, because once we've created, I think it's going to be very important to create some algorithms that if these are the signs, it points to that. Because without that, it's going to become it's going to remain very, very subjective and create segments. I think it's also important, once we have created what you call the independent variables, okay, how do we create a model out of that? It is going to be a rather complicated regression model. It is going to be very, very an intensive analytics approach. And because it will also lead to certain kind of classifications. Then, it is about, then the next point will be about creating early warning systems. Because the thing here is, what leads to what? And the other point is, it's going to be very important for us to have them talk about it. Okay. Therefore, can we give them some self-completion questionnaires or something in an app, something that's device agnostic? Not everybody will have a smartphone. But can I fill in things every day? I'm the best person to understand how I'm feeling. As I feel, I click. If it happens for 3 days and stops, I'm fine. The moment it crosses a particular danger zone, then I know I should be talking to people. So that initial acknowledgement is going to be very, very, very important. And we've seen that in some of the other countries, some of the Western countries, where the moment these signs come up, certain support systems are activated. Okay? The medical fraternity is alerted and so on and so forth. This is going to be very important because if you have to look ahead within the way Niti Aayog operates, it operates on very real data. This will be absolutely critical. And then finally, very clear, very regular reports. Because a thing as fluid as mental health, you can't just say कि एक report बना लिए हैं 3 साल बाद देखेंगे. There will have to be very clear live dashboarding, the way it's happening, percolating down to the districts, some alert somewhere, and then then it goes into the policy making stuff. You do quarterly reports, you do annual reports. Typically, if I were to ask a corporate to do a sentiment analysis or a segmentation, I would recommend one to be done every 3 years. In mental health, I would say anything between 2 and 3 years, not beyond that. You would need to really renew your report every couple of years, definitely. But given the speed at which things do operate,
very well defined, all steps. I think one thing which we also should add up to, I'm sure the panelists do it, is the use of technology. That is something which will become, easy to reach out to the masses. Look at if you just take an example of the mobile user base in the country, 800 million smartphone users, 1.2 billion of mobile phone users. With this, if we reach out to them in time and dissemination of knowledge, dissemination of what is going to happen, post-pre, right, Shipra, what you're doing right now. I think the use of technology, AI, ML is something which will help all these steps to, scale more.
And in terms of this approach, I think some of the things the government is already doing. I like to bring an example. So there's a beautiful project called Prerna Project, of which we are a part as well. What it is trying to do is, it is trying to, and again, technology aids, understand how many people have clinical mental health issues. And that can be done very simply through self-reporting tests in multiple languages, right? And then also have data around a person's personal life. Say, for instance, if it's a farmer, has there been a crop failure? Has there been a loan default? Has there been a bread and butter issue for the family member? And then when the two coincide, what is the propensity of the person unfortunately taking that extreme step, which the farmer community does take in India? And then how do you use that information to prevent when someone is having that first clinical sign, and do that through a predictive model? So this is something that the government is already doing, IWill is a part of it. Another way in which AI and technology is disrupting is, because IWill again with Microsoft is doing it, is creating simple CBT models in various languages, completely technology-led. Why is this important? Because we have a dearth of clinicians, but also and the AI and the information that comes from US, UK, other places, isn't relevant to the country that we live in, right? The mental health issues that happen to a woman or a man here, the reasons of it, the context of it, the problem of it is so local. So how do you build an AI machine for cognitive behavioral therapy that's based on US, UK specific data? That's going to be irrelevant here. How do you build locally such models, scale them not just on text, but scale them on tele? That's using AI to basically build conversational models over call. So a lot of this work is already happening, and I think that's where the government is focusing, to build a data model for the country, understand the social determinants leading to mental health issues, but also understand the clinical levels of an illness. Like today, we have enough data to tell that these many people in India are dealing with diabetes. When it comes to mental health, the worst thing, and this is painful for me, I've been working on this industry, we just give an approx number. हो सकता है 10 से 15% को हो. There's no exact number because where is the testing happening? Where is that data coming? How can I access it as a consumer? I can go and very well get myself tested for an A1C or a morning fasting sugar. I don't have access to the self-reported tool as well as yet, and know that it is clinically accurately telling me what the problem is. So that's where we need to start with, and technology very well can aid with that. In terms of treatment cure, there are enough and more are being created, leveraging technology. We're not reinventing the wheel, we're just using technology to reach the last mile and also reach in the languages that people can understand and speak.
Yeah, I have one question. This is very interesting, but are you open to get critic somewhere?
Oh yeah.
So the point is, ma'am, you stated a point that, okay, if there's a disease, you can dissect it and you can understand it, and if there's a mental health problem, you can't dissect and there's no theoretical model. So the concept of, you said that, there's no theoretical model to understand mental health issues.
I said there is not a, so just like we have a physical health model, which means I can go and get tested, I have a doctor, and then I have a higher acuity care. We have those pieces. We don't have a model that's brought that in together. The pieces are already there.
Okay.
There are already clinically validated self-reporting tools that can actually
for
test.
example, what happens if you have a diabetes, if you are prone to diabetes, you get to know, you just go to a path lab, go and you get your sugar tested. What she's trying to say is that we do not have that similar kind of model.
Infrastructure, industry-led infrastructure is not there for us to be able to do that. Whether there is science around it.
So you're talking about an infrastructure or a model for a predictive analysis?
No. So this is, that was in reference to another question that we were tackling at that point. This 6-step approach is of course around the predictive model, right? And this kind of takes into the social deterministic approach as well. So we have a clinical model. I'll give you an example. There is a 10-question battery test that can tell whether currently you are going through depressive symptoms or not. What it doesn't go ahead and tell you is, or understands it, your reasons of having that symptom could be very different than what mine could be, or a farmer's could be.
Certainly.
Right.
So the model which you're talking about does not play any role at that point of time. See, the point is you're moving from a qualitative approach to a quantitative approach here. I'm saying this as a cognitive sciences and a behavioral sciences researcher. So, point is there needs to be a lot of changes in this existing model. You're going in a very broader perspective. You're not narrowing down to the thematic analysis, like the farmer community for that matter.
That's what I was giving as an example. So that's why.
So if this is your model, there needs to be a lot of.
Correct.
You need to rethink the model a lot.
I think if I may add to the conversation, the point here is that when we talk about mental health, the model is being discussed in context of the infrastructure. If you put back the sentence that you just quoted in context, because contextualization is really important whenever we are listening to a broader discussion, right? And then coming back to the model, mental health is not something which can be measured by a blood test, as mentioned multiple times by the experts. And also the people who are currently licensed to do such diagnosis have come up with these policies. So because you're talking about something that's abstract, so nuanced, that may develop because of the situation that you are in currently, or maybe your family, or maybe the education institute that you are going to, and hence there always will be a quantitative, like an abstract element to it, I would say. And hence your approach would not work in it, but the reason that this model is going to work, and it is my opinion, is because it is adding technology to the places wherein it can be added. Because I think Shipra would be in a better position to explain the chatbot if.
Sure. So basically, what happens is that whenever you're talking a model, it's a pretty broad model, right? And that's something which is also for discussion. This is not something that's been already out there in the policy. So your questions are extremely pertinent, important, they're well taken. What I was specifically going to was an actual implemented model on the ground that we are working with a certain government, state government in India, where what we are doing is, say for instance, it's a 5 lakh farmer community. What are the clinical disorders that they may have currently? And there are enough self-reported tests that are validated to test it. And in the same arena, also kind of gather the data of what is their personal condition at this point, right? So if it's a farmer, is there a loan default that has happened? If it's a farmer, has there been any close family farmer death in the family? If it's a farmer, how many people is he responsible or is she responsible in terms of the bread earning? And then putting that data together, what is the risk of this person escalating to a situation which the government wants to avert and work on? And then taking that data in and using it to bring in the right help. So say for instance, it's a loan default and the person is dealing with very mild forms of depression, right? Then what can you do? You can actually bring in certain solutions at the financing level, right? Because this is a model created by the government. You have to understand that the nature of mental health is clinical, but it is also social deterministic. It is also where it is playing. It is also sometimes the fact that he doesn't have the money to pay back his loan and he takes his life. So those kind of data points first need to be brought into the domain and then the work needs to start. So what Sid was presenting was an overarching model that will or may not work for the country. But the example that I was quoting is completely different. It just takes one particular segment of that 6-step model.
All right, I think before everybody kills me for the discussion overshooting, I shall thank everybody for your.
Can I have one question?
Go ahead.
Please.
Can we do one thing? Can
One
we do one
observation.
thing?
This,
Can we close this and meet at tea?
Yes.
Yeah.
You can go for it. One question should be fine.
It's one question.
One question.
I don't have a question, just like a small
Yeah.
60-second observation.
Yeah.
So while we are discussing about mental health at so many levels, just that while we are preparing tech models, etc., but it's also about how we prepare our society such that we ourselves become that, because before the word mental health came
Correct.
forward, we used to talk to our friends, family, colleagues, gali nukkad ke dost and other stuff.
We discussed that and that was a part
We
of
discussed that.
another discussion.
Might have
We
missed
could
that.
not do it
Start
in lack of
हमने
time.
यहीं से शुरू की थी कि
Start.
पहले बात करते हैं, फिर मॉडलिंग करते हैं.
एक चीज है, this will continue for years, right? Because India needs to evolve in that direction. We've made a 16-minute start, right?
I've had a question.
Yeah.
I'm so sorry for interrupting and I'm really sorry.
Would you please mind taking that question outside?
Oh, yeah.
I think it's for the audience also.
Closing address after this.
It's just going to take 30 and it's an observation mostly. I think Shipra, you started with applauding the public health systems in the country and the kind of work ASHA workers and ANMs are doing, and then maybe they can be the community first responders. I have a different view because they are already burdened in terms of the kind of public health delivery they're doing. Secondly, the prevalence of mental health can be at all the levels, different genders, different age groups. So these first responders have to be built at different agencies in terms of schools, colleges, and then catering to different genders. Secondly, my opinion is different in terms of building at different age groups and gender is because you understand a nurse is a nurse who treats physical well-being is different from a first responder in a emotional well-being system. So ANM or an ASHA cannot be the right person because you will be influencing policy. This is one of the things I think shouldn't be put on the shoulders of ANMs and ASHA.
Absolutely.
And because it is bound to collapse.
Correct. And actually we've already recommended that to the government.
Great.
What you just said, I was saying that there was a policy for that, but in our recommendation, I'll give you an example. So in Mandya district, we ran a mental health program for ASHA workers because they were so down with the distress.
Exactly.
So we actually said that these are not the people who will be your mental health first responders as well, and that's where technology comes into play. So I think we definitely need another discussion. There's a lot of beautiful work that the government is doing, that startups are also doing, and a lot of public policy makers are also doing. Organizations like Sattva Consulting and ACT Grant.
I work with
Sattva. So Sattva is actually
come up with in telehealth. They're working.
ACT is funded us at
Oh, great.
IWill as well. Thank you.
Thank you so much, everyone.
Thank you, everyone.
Thanks, guys.